Sometimes when treating a patient with a multi-system trauma, it's difficult to differentiate between the different types of injuries. So in this case here, let's look at three different main injury types. We've got something that could involve musculoskeletal, we have potential for head injuries, and then we also have soft tissue related trauma, which could include internal bleeding. So looking at this scenario, you are treating a patient that was the victim of a battery. The patient is unconscious and only responds to painful stimulus. Physical assessment of the body reveals a dilated left pupil that doesn't respond to light, a laceration to the left arm with minor bleeding, bruising to the left upper quadrant, and a closed deformity to the right lower arm. Vitals are blood pressure of 94/60, pulse of 58 and weak, respiratory rate of 28 and irregular, SpO2 of 89%, and a blood glucose of 99. So based on the information we have, what do we suppose is most likely going to be the issue with our patient? What is it that we want to try to focus on treating? So let's look at this scenario in detail here. Let's first of all look at some of the main points here. So the patient is unconscious, right? An unconscious patient, that's a big deal. I want to pay attention to that. Responds only to painful stimulus. Looking at our physical assessment, we have a dilated left pupil that's not responding. We have a laceration to the left arm with only minor bleeding, and that's important to note. Bruising to the left upper quadrant, right? That's kind of important. And a closed deformity to the right lower arm. So again, we'll look at those things, right lower arm. Now, before we get into the vitals, let's look at this stuff here. Where can we associate those injury patterns as far as these different types of injuries? So unconscious and only responding to painful stimulus. Well, I know for a fact that if I have a brain injury, altered mental status would be something. So let's write in here the fact that the patient is unconscious and they're only responding to painful stimulus. Go down here, a dilated left pupil. Again, dilated left pupil tells me that it's probably going to be something having to do with the brain itself, especially because it's unilateral. If both pupils are dilated, it could be something more profound, but in this case, since it's just a single pupil, I think it's going to be more related to a head injury. So let's see, dilated left pupil. All right. Now we have a laceration to the left arm with minor bleeding. That should fall, the laceration itself is going to fall into the soft tissue area here. So LAC, I'm going to abbreviate that as LAC, and that was to the left arm, right? So L to the left arm. Bruising to the left upper quadrant. All right, so bruising again is going to fall into the soft tissue area here. And we said that is to the left upper quadrant. And then we've got a closed deformity to the right lower arm. That would fall into the musculoskeletal range here, right? So deformity to the right arm. All right, so based on our physical assessment, I've got three things that fall into the head injury range here, two things that could fall into soft tissue, and one into musculoskeletal. Let's look now at our vital signs and see how we can group those. So a blood pressure of 94/60, that's relatively low, especially assuming this is an adult patient. When I think about low blood pressure, I think about shock. Musculoskeletal injuries, so while we can incur bleeding from musculoskeletal injuries, we are not likely going to go into shock as a result of that. With a head injury, I would expect to see increasing blood pressure in order to offset the pressure inside the brain. With soft tissue trauma, specifically internal injuries here, and I see that I've got bruising to the left upper quadrant, which is usually an indication of bruising beneath the skin, or bleeding beneath the skin, I'm thinking that this would be most likely the cause of a low blood pressure. So I'll write in here the fact that my patient is hypotensive would fall into that category. Pulse of 58 and weak. Now, if my patient is in shock and they're hypotensive, again, I should be thinking, hey, this is going to be fast, right? The pulse rate should be up in an attempt to try to compensate, but it's not. I do know that with head injuries, the pulse tends to dial down a little bit. So maybe that could be related. We'll write that over here. So we'll say bradycardia falls into this category. Respiratory rate 28 and irregular. Now the increased respiratory rate, that definitely falls into my parameters of shock and compensation, but the irregularity, that's what throws me off. So in this case here, my increased respiratory rate would fall here, but the irregular component of my respiratory rate falls into the head category. SpO2 of 89% more than likely is just a result of us not moving enough air, right? The patient isn't exchanging air adequately, which could really fall into either one of these areas, so we'll just leave that off for the time being. A blood glucose of 99, that's important because that tells me that this altered mental status here is not actually a result of the glucose. So glucose doesn't help us rule any or confirm anything, but it does help us rule out the fact that the altered mental status would be a result of hypoglycemia. So now I'm looking at these things, right? And out of everything that I found, only one thing really falls into musculoskeletal, so this is probably not going to be an immediate life threat that I need to be concerned about. Now I'm looking in here that the patient is unconscious, only responding to painful stimulus. They've got a dilated left pupil, they have a low heart rate, and they have an irregular respiratory rate. All of these things are screaming closed head injury to me. Over here for soft tissue, I've got a laceration to the left arm, but remember that that bleeding was minor. I do, however, have bruising to the left upper quadrant, which could be something related to the spleen. The patient was hypotensive, and they had an increased respiratory rate. So based on those things, I'm thinking, all right, this patient could be potentially in shock, right? So that should be a consideration. And this patient could also have a closed head injury with increasing intracranial pressure, or ICP. Which one of these is going to be more deadly? Well, that's a good question. Quite honestly, they're both extremely deadly. But we do know that although with increasing intracranial pressure, that is going to have negative impacts on the brain, shock will have negative impacts throughout the entire body. We're going to want to treat our patient for both of these situations here. And what this suggests is that this is a multi-system trauma where the patient likely has a closed head injury. And although we don't see all of the signs and symptoms that we would expect to see, it's likely because they have some type of internal bleeding. And as a result of that, we're seeing a crossover between hypotension or hypovolemic shock and a crossover between the closed head injury.